Inside the emergency department of Denver General Hospital in Denver, Colorado, tension filled every hallway after a devastating multi-vehicle highway accident sent several critically injured patients to the trauma center at once. Operating rooms were running at full capacity. Trauma teams rushed between emergency bays, and surgeons had only minutes to decide who required immediate surgery. One patient, a 30-year-old state trooper, had suffered severe abdominal trauma. His blood pressure continued falling despite aggressive treatment, and the surgical team prepared to move him into the operating room. Standing quietly near the family waiting area was an 80-year-old man wearing a faded olive field jacket with an old Army Medical Corps patch stitched onto one sleeve. He carried a weathered leather medical notebook beneath one arm, leaned on a polished walnut cane, and wore a pair of well-used reading glasses hanging from a cord around his neck. Unlike everyone else watching the organized chaos unfold, he never looked toward the monitors or the rushing nurses. Instead, his attention remained fixed on the patient's breathing, the subtle color of his skin, the rhythm of the medical team's communication, and the blood soaking through the temporary abdominal dressing. A young trauma surgeon noticed the elderly visitor quietly observing the treatment area. "Sir," he said politely but firmly, "this is a restricted medical zone." Another resident smiled. "Family members need to remain behind the line." A third doctor looked at the old man studying the patient instead of the waiting room television and quietly joked, "Unless you've got another medical degree hidden somewhere, we'll take it from here." Several exhausted staff members laughed briefly before returning to work. The elderly man simply smiled politely and took one small step backward. A few moments later, as the trauma team prepared to wheel the patient toward surgery, the old man calmly spoke. "Excuse me, doctor." The lead surgeon turned. "Yes?" The elderly man pointed gently toward the patient's abdomen. "Before you open him, would you mind checking one thing?" The surgeon sighed, trying to remain courteous. "Sir, we don't have time." The old man nodded respectfully. "That's exactly why I'm asking." Before anyone could respond, the hospital's chief of surgery entered the trauma bay after finishing another emergency operation. He glanced across the room, saw the elderly visitor, and immediately stopped walking. Without hesitation, he crossed the treatment area, stood at attention, and extended both hands with unmistakable respect. "Colonel Dr. Samuel Sam Whitaker," he said warmly. "I never imagined I'd see you standing beside another trauma table." Every conversation stopped. Only moments earlier, everyone had assumed the quiet old man was merely a concerned visitor offering unwanted advice. None of them realized they were standing beside one of the most respected battlefield surgeons in U.S. Army medical history, a man who had spent nearly 4 decades performing life-saving operations in combat hospitals around the world, trained generations of trauma surgeons, and earned a legendary reputation for recognizing fatal internal injuries before diagnostic equipment could confirm them. Inside the worn leather notebook he carried rested decades of handwritten surgical observations from battlefield hospitals, along with one sealed letter from the chief surgeon, who had once taught him that the patient always begins telling the diagnosis before the first incision is ever made. Before the operating room doors closed that afternoon, every doctor in the trauma center would discover why experience sometimes sees what technology has not yet revealed, learn the emotional story hidden inside the old medical notebook, and witness an 80-year-old battlefield surgeon save a life without ever picking up a scalpel. The emergency department at Denver General Hospital was operating beyond capacity after a chain reaction collision on Interstate 25 sent multiple critically injured patients to the city's Level 1 trauma center within minutes of one another. Ambulance sirens echoed continuously outside as trauma teams moved rapidly between emergency bays. Nurses prepared blood transfusions, anesthesiologists organized operating rooms, and surgeons made life-or-death decisions under enormous pressure. One patient demanded everyone's attention. A 30-year-old Colorado state trooper had suffered severe blunt abdominal trauma after his patrol vehicle had been crushed between 2 trucks. Despite aggressive fluid resuscitation and blood transfusions, his blood pressure continued falling. The fast ultrasound showed internal bleeding, and the trauma team decided to move him immediately into surgery. Standing quietly near the entrance to the trauma bay was an 80-year-old man wearing a faded olive field jacket with an old U.S. Army Medical Corps patch sewn onto the sleeve. Beneath one arm, he carried a weathered leather medical notebook, while a polished walnut cane supported his slow, deliberate steps. Unlike the anxious families gathered in the waiting area, he never looked toward the heart monitors or the flashing medical equipment. Instead, he carefully watched the patient's breathing, the changing color of his skin, the swelling beneath the temporary abdominal dressing, and the way the nurses were replacing blood bags faster with each passing minute. A young trauma resident noticed him first. "Sir," she said politely, "this area is restricted." Another surgical resident smiled. "If you're waiting for someone, the family lounge is down the hall." A third doctor glanced at the elderly man studying the patient instead of leaving the area. "We'll take good care of him, sir." Several exhausted staff members smiled politely before returning to work. The old man simply nodded and stepped back without saying a word. Moments later, as the trauma team prepared to wheel the patient toward the operating room, the elderly physician quietly spoke. "Doctor," the lead trauma surgeon turned. "Yes?" The old man pointed gently toward the patient's abdomen. "Before you begin surgery," he paused politely, "would you mind checking his left flank one more time?" The surgeon looked confused. "We already examined him." The elderly man nodded. "I know." He smiled kindly. "Please check it again." One of the residents quietly sighed. "Sir, we're losing valuable time." The old man lowered his eyes respectfully. "That's exactly what worries me." Before anyone could continue the conversation, the doors to the trauma bay opened again. Chief of Surgery, Dr. Michael Reynolds walked in after completing another emergency operation. As he scanned the room, his eyes stopped immediately on the elderly visitor standing quietly beside the wall. Without hesitation, he crossed the trauma bay, removed his surgical gloves, and warmly shook the old man's hand with both of his own. "Colonel Samuel Whitaker," he said with unmistakable respect, "welcome back." Every conversation in the trauma bay stopped instantly. The residents stared in complete disbelief. Samuel smiled warmly. "Good afternoon, Michael." Reynolds laughed softly. "You should have told me you were coming." Samuel glanced toward the injured state trooper. "I was only visiting an old colleague." He looked back toward the patient. Then I noticed something I couldn't ignore. One of the younger surgeons looked at the chief in confusion. "Doctor, you know him?" Reynolds turned toward the residents with a smile. "Know him?" He gently placed one hand on Samuel's shoulder. "Colonel Dr. Samuel Whitaker spent 38 years as one of the Army's leading battlefield trauma surgeons." He looked around the room. "Half the damage control surgery techniques we teach in this hospital today were refined by teams he trained." Complete silence settled over the trauma bay. The residents slowly looked back toward the quiet old physician. Only moments earlier they had assumed he was an elderly visitor, offering unsolicited advice. Now they realized they were standing beside the surgeon whose battlefield case studies had become required reading during their trauma training. Samuel rested one hand on his worn leather notebook before quietly speaking again. "I hope I'm mistaken." He looked toward the young trooper on the stretcher. "Because 40 years ago, I saw another soldier whose injuries looked almost exactly like these." The trauma bay became unusually quiet after Colonel Samuel Whitaker mentioned another patient from 40 years earlier. The younger residents looked from the elderly surgeon to Chief of Surgery Michael Reynolds, sensing that there was a story every senior physician in the room already knew. Reynolds slowly nodded. "Operation Iron Valley." Samuel smiled faintly. "I was hoping I'd never recognize those signs again." One of the chief residents stepped forward. "Colonel, what happened?" Samuel rested his weathered leather medical notebook on a nearby instrument cart before answering. 40 years ago, our field hospital received a young infantry sergeant after an explosion." He looked toward the injured state trooper lying on the trauma bed. "Blunt abdominal trauma. Falling blood pressure. Internal bleeding. Almost identical." The room fell silent. "The field medics believed he had a ruptured spleen," Samuel continued. "Everything pointed in that direction." One resident nodded. "That's what we're thinking here." Samuel smiled gently. "So were we?" He paused for a moment before continuing. While everyone prepared for a routine damage control laparotomy, an old combat surgeon walked over to the patient. Several younger doctors exchanged curious glances. "He didn't look at the x-rays," Samuel said. "He barely glanced at the monitors. He simply watched the patient breathe. Then he asked us one question." Samuel looked toward the young surgeons. "Why is only the left side of his abdomen moving?" Complete silence settled over the trauma bay. One resident frowned. What did that mean? Samuel slowly walked beside the injured trooper without touching him. The senior surgeon noticed something every monitor had missed. He pointed gently toward the patient's torso. Each breath caused the right side of the abdomen to tighten slightly. The left side, he paused, hardly moved at all. Another resident quietly whispered, "Muscle guarding?" Samuel nodded. Partly, but more importantly, he looked directly at the group. The pressure inside the abdomen wasn't equal anymore. Chief Reynolds folded his arms, already understanding where the story was going. Samuel continued. The old surgeon suspected a massive retroperitoneal hemorrhage. One resident's eyes widened. "Behind the abdominal cavity?" Samuel nodded. "Exactly." He looked toward the temporary dressing, covering the trooper's injuries. A patient like that can appear more stable than he really is. Because much of the bleeding is hidden, the trauma bay became completely silent. Samuel opened the worn leather notebook. Inside were hundreds of handwritten notes from military field hospitals, rough anatomical sketches, vascular diagrams, and observations collected during nearly 4 decades of emergency surgery. Some pages were stained by iodine. Others carried faded blood marks that time had never completely erased. "After that operation," Samuel said quietly, "I started writing down every lesson the battlefield ever taught me." One resident carefully turned a page showing hand-drawn diagrams of abdominal injuries. "You wrote all of this?" Samuel smiled. "Every difficult case." He slowly turned to the final pages. Resting between them lay a yellowed, sealed envelope. Chief Reynolds immediately recognized it. Colonel Anderson's letter. Samuel gently rested one hand over it. "He gave it to me after that surgery." Reynolds smiled softly. "You've carried it ever since." Samuel nodded. "He made me promise never to open it." He looked around the trauma bay, "until I found a generation of surgeons who understood that the patient often reveals the diagnosis before the scan ever does." At that very moment, the anesthesiologist preparing the trooper for surgery looked up from the monitor. "Doctor," he called. His blood pressure just dropped again. Every member of the trauma team turned toward the patient. Samuel calmly watched the young man's breathing for only a few seconds before quietly saying, "Please don't start with the spleen." The lead surgeon looked at him. "Why?" Samuel pointed gently toward the trooper's left flank. "Because the injury that's about to kill him," he paused, "isn't where everyone is looking." The operating room doors remained open as the trauma team froze for just a moment. Every second mattered, yet no one ignored the quiet confidence in Colonel Samuel Whitaker's voice. Chief of Surgery, Michael Reynolds, looked directly at the lead trauma surgeon. "Dr. Harris," he said calmly. "Give him 30 seconds. The young surgeon hesitated. "Sir, his pressure is crashing." Reynolds nodded. 30 seconds. Harris immediately knelt beside the stretcher, while Samuel stepped forward for the first time. He never touched the patient at first. Instead, he watched the rise and fall of the trooper's chest, the tension across his abdomen, the slight discoloration spreading along the left side of his lower back, and the way fresh blood products were disappearing almost as quickly as they entered the patient's veins. Finally, Samuel gently placed 2 fingertips against the patient's left flank. He closed his eyes for only a brief moment before looking at Harris. "Do you feel that?" Harris frowned as he repeated the examination. At first, he noticed nothing unusual. Then, as the patient took another shallow breath, he felt a faint but unmistakable fullness deep beneath the muscles. It was firmer than the surrounding tissue, and seemed to expand ever so slightly with each passing minute. "That's impossible," Harris whispered. Samuel nodded quietly. "No." He looked toward the CT images displayed on the monitor. "What's impossible is believing the bleeding is only inside the abdominal cavity." Harris stared back at the scans. The spleen showed obvious injury, exactly as everyone had expected. But Samuel continued, pointing farther back. "Look behind the left kidney." Harris stepped closer to the monitor. The radiologist, who had just entered the operating room after reviewing additional image reconstructions, suddenly stopped speaking. He enlarged one section of the scan. The room fell silent. A dark shadow extended behind the kidney and along the psoas muscle. "Retroperitoneal hematoma," the radiologist said quietly. "Large one." Harris felt his stomach tighten. "How did we miss that?" The radiologist shook his head. The splenic injury drew everyone's attention. The bleeding behind it blended into the surrounding tissue. Samuel spoke softly. "The body often hides its worst injuries behind the obvious ones." The anesthesiologist interrupted. "Pressure is 60/38. Harris immediately turned toward the surgical team. "Change the operative plan." His voice became firm. "We're controlling the retroperitoneal hemorrhage first." Nurses rearranged instruments within seconds. Additional vascular clamps were opened. Blood bank personnel rushed more units into the operating room. As the first incision was made, Harris followed the pathway Samuel had described. Within moments, suction filled with rapidly accumulating blood. Then everyone saw it. A torn branch of the left renal artery had continued bleeding into the retroperitoneal space, concealed behind damaged tissue, and almost completely hidden from the initial interpretation of the scans. Vascular clamp, Harris called. The bleeding slowed. Seconds later, it stopped. The anesthesiologist looked up from the monitor. Pressure's coming back. 68. Then 75. Then 83. A quiet sigh of relief spread across the room. One scrub nurse looked toward Samuel, who had quietly stepped back against the wall without saying another word. Nearly an hour later, the operation was complete. The trooper remained in critical condition, but the source of the life-threatening hemorrhage had been repaired before irreversible shock set in. As Harris removed his gloves, he walked slowly toward Samuel. For several moments he struggled to find the right words. Finally, he extended his hand. "Colonel Whitaker." Samuel shook it warmly. "Yes, doctor?" Harris lowered his eyes. "A few minutes ago, I thought you were delaying us." He paused before continuing. "The truth is, you saved us from operating on the wrong priority." Samuel smiled gently. "No, doctor." He looked through the operating room window toward the recovering patient. The young man saved himself. Harris looked confused. Samuel pointed toward the now-still monitor, displaying the patient's vital signs. "He never stopped telling us where he was bleeding." He tapped the weathered leather notebook resting beneath his arm. "We simply remembered how to listen." At that moment, Chief Reynolds quietly walked over holding the old notebook in his hands. Tucked inside its back cover remained the same yellowed envelope that had traveled with Samuel through nearly 40 years of military hospitals, humanitarian missions, and trauma centers around the world. Reynolds looked at Samuel with a gentle smile. "Colonel," he said softly, "I think today's the day." Samuel rested his hand on the unopened letter for a long moment before slowly nodding. "Yes," he whispered. "I believe Colonel Anderson would finally want them to hear what he wrote." The operating room gradually returned to its normal rhythm as the trauma team transferred the young state trooper to the intensive care unit. Outside the recovery area, surgeons quietly removed their caps and masks, but no one hurried away. Every resident remained standing near Colonel Samuel Whitaker, waiting to hear the story behind the yellowed envelope that had rested inside his weathered leather notebook for nearly 4 decades. Chief of Surgery, Michael Reynolds carefully placed the notebook on the conference table beside the operating suite. "For 38 years, he said softly, "I've asked him what was inside that letter." Samuel smiled. "And for 38 years, I gave you the same answer." Reynolds nodded with a laugh. "You weren't allowed to open it yet." Samuel gently slid the envelope from the notebook. Its paper had become fragile with age, and the ink across the front had faded almost to brown. Written in Colonel Anderson's unmistakable handwriting were only a few words. "To Sam, open this only after you meet surgeons who are willing to examine the patient before they examine their certainty." The room fell completely silent. Samuel carefully broke the seal for the first time. He unfolded several handwritten pages and began reading aloud. "If you're holding this letter, then you've finally found doctors who understand that surgery is not a competition between knowledge and humility. It is impossible to save lives if pride enters the operating room before compassion does." Several residents lowered their eyes. Only an hour earlier, they had politely dismissed the elderly man's warning because they believed modern imaging had already provided every answer. Samuel continued reading. "Technology will become faster than anything we could imagine. Scanners will grow clearer. Monitors will become smarter. Artificial intelligence will help interpret diseases we once struggled to recognize. Welcome every advancement with gratitude, but never allow a machine to replace the oldest diagnostic instrument medicine has ever possessed: the careful eyes, patient ears, and thoughtful mind of a physician standing beside another human being." No one spoke. The words seemed written not only for Samuel decades ago, but for every doctor in the room. He turned to the final page. "There will come a day when someone younger than you believes experience has become outdated. Do not argue with them. Do not embarrass them. Teach them quietly. The lesson they remember will never be the operation you performed. It will be the respect you showed while saving a life together." Samuel folded the letter with slow, steady hands. Tears quietly filled Chief Reynolds' eyes. "Colonel Anderson was talking about today," he whispered. Samuel smiled gently. "No." He looked around the room at the young surgeons. He was talking about every generation that would come after us. Just then, the trauma radiologist entered carrying the patient's finalized imaging report. "Dr. Reynolds," she said. "We finished the complete reconstruction." She placed the images on the screen. The enlarged three-dimensional scan now clearly revealed the torn branch of the left renal artery hidden deep within the retroperitoneal space. If surgery had focused only on the splenic injury first, she explained quietly, the uncontrolled hemorrhage behind the kidney would almost certainly have continued long enough to cause irreversible shock. One of the residents slowly exhaled. "We would have lost him." The radiologist nodded once. "Very likely." Chief Reynolds turned toward the young surgeons. "Remember what happened today." He gestured toward the imaging on the screen. The scan confirmed the diagnosis. Then he looked at Samuel. But the patient made the diagnosis first. Samuel gently closed the weathered leather notebook and rested one hand across its worn cover. "Every patient," he said softly, "is speaking from the moment you first see them." He looked around the room one final time. "The question is never whether they are telling you the truth." A warm smile crossed his face. "The question is whether you've become quiet enough to hear it." By the following morning, the young state trooper's condition had stabilized. The vascular repair remained secure. His blood pressure had returned to normal, and the intensive care team finally informed his family that he was expected to make a full recovery. News of the extraordinary operation quickly spread throughout Denver General Hospital. But the story being repeated in hallways and operating rooms was not about an elderly surgeon who had outperformed modern technology. It was about how one quiet observation, made before the first incision, had completely changed the course of an operation and saved a life. That afternoon, Chief of Surgery Dr. Michael Reynolds gathered every surgical resident, attending physician, trauma, nurse, and medical student inside the hospital's surgical education auditorium. As hundreds of medical professionals filled the room, Reynolds walked onto the stage, carrying Colonel Samuel Whitaker's weathered leather notebook. He placed it gently on the podium before looking across the audience. "Yesterday," he began, "we witnessed something every surgeon should remember for the rest of their career. We spend years learning anatomy, mastering surgical techniques, and trusting the remarkable technology available to modern medicine. But before there were scanners, before there were monitors, before there was artificial intelligence, there was observation, and observation is still where every great diagnosis begins." He then turned toward the side entrance. "Please welcome the man who reminded all of us of that lesson." The audience immediately rose to its feet as Colonel Samuel Whitaker slowly entered the auditorium, leaning on his polished walnut cane, while carrying the same faded Army field jacket over one arm. The applause continued for nearly a full minute before finally settling into complete silence. Samuel smiled modestly before stepping behind the podium. "Thank you," he said softly. "But yesterday wasn't about me." He looked around the room at the young doctors. It was about a patient who never stopped telling us where he was bleeding. A surgical resident stood and asked the question everyone had been wondering since the operation. "Colonel, how many surgeries have you performed during your career?" Samuel laughed quietly. "I stopped counting after 12,000. A wave of astonishment spread through the auditorium. Another resident asked, "How did you become so good at recognizing injuries everyone else missed?" Samuel's smile slowly faded. "By remembering every patient I couldn't save." The room fell completely silent. "Success teaches confidence," he continued. "Failure teaches judgment. Every name written inside this notebook belongs to someone who helped me become a better surgeon, whether they survived or not." He carefully opened the worn leather notebook for what seemed like the final time. Every page contained anatomical sketches, handwritten observations, operative notes, and lessons gathered from nearly 4 decades of battlefield hospitals, humanitarian missions, and civilian trauma centers. Between the final pages still rested Colonel Richard Anderson's letter. Samuel gently removed it before turning toward Chief Reynolds. "Michael," he said quietly, "I've carried this notebook for 38 years. Reynolds smiled. "I know." Samuel placed both the notebook and the letter into his hands. "It's time they belonged to the next generation." Several weeks later, Denver General Hospital unveiled a permanent exhibit inside its Surgical Education Center. Resting inside a glass display case were Samuel Whitaker's leather notebook, Colonel Anderson's handwritten letter, the operative report from the state trooper's surgery, and the CT images showing the hidden retroperitoneal hemorrhage that had nearly been overlooked. At the center of the display stood a bronze plaque engraved with the words, The Anderson-Whitaker Surgical Legacy, dedicated to Colonel Dr. Richard Anderson and Colonel Dr. Day Samuel Whitaker, whose humility, skill, and devotion to their patients continue guiding every surgeon who enters an operating room. Great surgeons do not begin by studying the scan. They begin by studying the patient. Years later, after Colonel Samuel Whitaker passed away peacefully at the age of 91, every new surgical resident joining Denver General Hospital began their first day not inside an operating room, but in front of that display, before learning robotic surgery, advanced imaging, laparoscopic techniques, or complex trauma procedures. They first heard the story of an elderly man, whom everyone believed was simply an old visitor standing outside a trauma bay until he quietly recognized the injury that no one else had seen. Beside the display, one final inscription greeted every future surgeon who walked through the doors of the education center. Medicine changes, technology advances, instruments become more precise, but the greatest surgeon will always be the one who listens to the patient before listening to certainty. Most visitors saw only an old notebook, a faded military jacket, and a yellowed letter preserved behind glass. Those who understood the story saw something far greater, a lifetime of wisdom earned one patient at a time, a promise faithfully kept across 38 years, and the enduring reminder that the finest legacy any surgeon can leave is not the number of operations performed, but the judgment, humility, and compassion passed into the hands of those who will one day stand where they once stood. Every operating room is filled with remarkable technology. High-resolution scanners reveal injuries hidden deep inside the human body. Sophisticated monitors measure every heartbeat and every breath. Robotic instruments allow surgeons to perform procedures once thought impossible. Yet none of these extraordinary advances can replace the most important instrument in medicine, the careful judgment of a physician who has learned to observe before acting. Colonel Samuel Whitaker understood that lesson after spending nearly 4 decades in battlefield hospitals, where there was often no CT scanner, no advanced laboratory, and no second chance. In those moments, survival depended on listening to the patient, studying every movement, every breath, every subtle change the body revealed. Those experiences taught him that the human body often speaks long before technology confirms what is happening inside. The young doctors in this story were intelligent, compassionate, and exceptionally well-trained. They trusted the best medical knowledge available to them, and there was nothing wrong with that. What Samuel reminded them was that experience does not compete with science, it completes it. Technology should strengthen a physician's judgment, never replace it. The greatest doctors know when to trust the images on the screen, and when to pause long enough to ask whether the patient is trying to tell them something the machines have not yet discovered. Perhaps the most powerful moment in this story was not when Samuel recognized the hidden hemorrhage, nor when the young state trooper's life was saved in the operating room. It was the moment he opened Colonel Richard Anderson's letter after 38 years, and passed both the letter and his weathered medical notebook into the hands of the next generation, because the greatest operation a surgeon ever performs is not always the one that saves a single patient. Sometimes it is the lesson that helps countless future surgeons save thousands more. That is how true legacies are built, not through fame, awards, or titles, but through knowledge quietly shared with those willing to learn. If this story touched your heart, please leave a comment and tell us where you're watching from. Have you ever met a doctor, nurse, paramedic, military medic, teacher, mentor, or elderly professional whose calm experience changed someone's life when everyone else had overlooked the answer? We'd be honored to read your story. Don't forget to like, share, and subscribe for more inspiring stories about medicine, veterans, courage, leadership, humility, sacrifice, wisdom, and the extraordinary people whose greatest achievements were not measured by recognition, but by the lives they quietly saved. May God bless every doctor making impossible decisions, every nurse standing beside patients through the longest nights, every emergency responder racing toward danger while others run away, every teacher passing on hard-earned wisdom, and every family waiting for a loved one to return safely home. And may we never forget that the finest surgeon is not the one with the steadiest hands alone, but the one with the humility to keep listening, the patience to keep observing, and the wisdom to remember that every patient begins telling their story long before the very first incision is ever made.